There's a lot going on. We had the FDA weigh in on this debate about 1 or 2 doses for those 2-dose vaccines. And then we have the crisis in LA. What is the latest?
Right. So, Adam, right now, the idea of dosing has been a conversation since before both Pfizer and Moderna were authorized. And that has been a conversation that continues, especially because we know that the supply of vaccines far outweighs the demand right now. And that is a problem they knew was coming. And so, in order to try and address that, the ideas have been half the dose, but still 2 doses, so that that prime booster strategy works efficiently, or just using 1 dose and then delaying the second dose until more vaccines are produced. And that's something the UK has already looked into and has adopted. But when it comes to at the top level and what officials think, we heard the World Health Organization say it could be okay to delay that second dose because of the extreme need and the extreme circumstances right now. So there have been provisions from their version of the advisory panel to do that. Meanwhile, the FDA last night weighing in, saying that everything that has been authorized should be followed as per the guidelines, and no changes can be made until further discovery, really, of what can be done with these doses. So no halving or anything like that as it stands right now. So, they are waiting on the data. I think the idea is that they should be able to eventually have some sort of strategy to expand the dose. We also know that the Surgeon General today told NBC that if the initial priority groups aren't, the demand from those groups is waning, that states should just move on to the next priority group, and therefore getting more people vaccinated. So a lot of things still at play here as we see how the vaccinations roll out.
And Sean, I just wanted to get your thoughts just on what's going on out in California right now, because we had the reports that the LA County paramedics were being told not to transport some patients that had low chances of survival. How dire, I mean, it makes it seem like it's extremely dire, but how dire is the situation out in California, and what position are the hospitals in right now?
That really, it's really a repeat of what we saw early last year here in the New York and metro area. That is something that, as it stands right now, is going to be, the hard decision that everyone has been talking about. Health experts have been saying for several weeks that mid-January is going to peak. This is something that is not going to be isolated to California, but also will be seen throughout the states. As hospitals have been trying to ramp up for this. We know that they have already predicted shortages of not just nurses, but also care within other provider community facilities. And so all of this going to say that with the sort of double whammy right now of post-holiday spike plus a highly transmissible strain, it really is putting pressure on systems. And they have already tried to do as much to prepare for a spike. But it's at the point now where the hard decisions that we saw in March and April last year are being once again put on the table. This is not new territory. We've seen this happen before here in the country. Shawna.